there's us, which is a stool-derived postbiotic that's been sterilized. And then there's fecal transplant. And so they're very distinct, and I'll define that right now. Fecal transplant is the live bacteria and everything in a stool. And that's what you've heard about in treatment of C. diff and in the Arizona autism study and research into fecal transplant, or what your experience was with fecal transplant. There's that, which you can get commercially for C. diff as a drug in a pill. And then ours, which is poop that's been from healthy screen donors that's been sterilized.
You mentioned a little bit, it's no live bacteria. Can you talk a little bit more about that safety protocol and how it's different? Talk to us about like how they're screened to make sure that we're getting the best poop possible.
How do you define health is the ephemeral question, right? So we were part of early day stool bank for fecal transplant, which is great because I got to sort of learn and evolve with the industry doing FMT. And so we approached our donors that way. Like, do you have any chronic disease history? The answer needs to be no. Do you have any acute medical diagnoses? No. You've never been given a prescription drug for any chronic disease. So no mental health, no, heart medication. I mean, our donors are like 30 to 40. We require donors to be over 18. We have a couple that are in their 20s. They've never been sick with any major diseases or chronic diseases. Maybe they had the flu once or twice, but they've had less than 5 antibiotics in their lifetime. And then it's really important that they meet the best that we can define as like a healthy microbiome environment. So what is their exposure based on what they do for a living? Are they ever exposed to VOCs or plastics or pesticides? And so that's a disqualifier. Do they have a healthy diet? Have they had a healthy diet more or less for most of their life? Were they vaginally born? Did they have breast milk predominantly for their first 6 months of life? Any of those types of things. We have a preliminary survey, then a follow-up survey that's several pages, and then we do blood and urine and stool testing for infectious disease, and then we do our best to define health through intakes and then screen out infectious risk with labs.